the 80s, 90s. I was practicing more or less like most other dental practices. In time, that got to be a little bit boring for me because there was nothing new happening, and I guess maybe 1995 to year 2000, all of a sudden there was this big boom in aesthetic dentistry. Everybody was doing aesthetic dentistry. And of course I got on that bandwagon also, took a whole bunch of continuing education courses, and I started doing laminates. And we started advertising that we're doing laminates, and in the 95 to 2000 time, when there was a real big economic boom, there were literally hundreds and hundreds of laminate cases that we were doing in the practice here. It came to a point where not a day passed where I was either prepping or placing a laminate case. And when the economy sort of bottomed out, people weren't doing them anymore. And that was the time when I started getting interested in implantology and placing implants. So I started taking courses on implant placement, and luckily right around that time is when the CAT scan machines made specifically for dentistry came into being. I was one of the first few offices on Staten Island that owned a CAT scan machine. Here, together with my son, with Jason, who will be talking. I mean, I consider him to be very quickly, in 5 years since he's out of his residency, I consider him to be as well qualified as I am, because we treat essentially all cases together. We consider each other equal, and it's a very nice thing to be able to discuss cases together, so we bounce all the cases off each other.
It's like I got a fast forward button in the world of dentistry. I have behind me someone with 30, 35 years of experience in the dental field. In addition to all the technical knowledge, additionally learned like customer care that he has such a strong natural understanding for. He actually came from Europe at a young age, around 11 years old, and from the time he came to this country, hit the ground running in all areas of customer care and customer satisfaction and related fields. He was a florist, a watchmaker, a caterer, a videographer, a photographer. What I gathered from all those various jobs he had since 11 years old, he really learned how to take a customer's wants and needs and really deliver to them, deliver what they ask for, and deliver it on time in a way that they just become satisfied. And he, of course, brought that knowledge and experience over to dentistry. There's a huge value in the end results we find with our patients. Basically, yes, we create new teeth for them. Yes, we create new smiles for them. Yes, we create the ability for them to chew. But really what it is, it's not so much about the teeth. It's about their new outlook on life, that they had this thing in their mouth weighing down on them for years and years and years that just affected every aspect of their life. It's also one of the reasons that additionally I got into dentistry in the first place, because around the time that I was of the age to look into a career, my father was just getting into these full mouth implant reconstructions, and a little bit of time that I would come here and volunteer, assisting him, and seeing the reactions from the patients, and seeing how their lives have been changed from having the implant work done. I saw that dentistry wasn't just about doing fillings and doing some cleanings and things like that, but it's about transforming lives.